Now, with regards to the different types of treatment plans, there's more than one set recommended time frame. This is part of the customization process I have created for my clients. So let's talk about the different time frames. First, there's the shortest treatment plan, which is about a 3 to 5 week time frame. This is what I call the minor adjustments treatment series. This is where we address discomforts and minor muscular imbalances. This plan is ideal for quick recoveries from strains and sedentary lifestyle tensions. A commitment to this concise therapy sequence can prevent the escalation of pain, ensuring a return to daily activities and getting back to being at the top of your game. The second type of treatment series is between 6 to 8 weeks in what I have called the Essential Rehabilitation Treatment Series. This particular treatment plan was crafted with moderate injuries and recurring stress-related aches in mind. This regimen is meant to help restore your strength and flexibility. This longer time commitment allows us to work through issues that need the increased focus to create lasting difference in your musculature.
Strategy without tactics is the slowest route to victory. Tactics without strategy is the noise before defeat. Sun Tzu, Art of War.
This legendary quote applies to many aspects of life. What it is telling us is that big goals need a strategy along with the proper tactics. This statement is true, and it applies to the world of massage therapy as well. When you are utilizing massage therapy to achieve a goal rather than a one-off feel-good session, then you're going to need to have the right strategy to maximize your healing outcome. In my opinion, most massage therapists have the right tactics, aka the hand skills, to help you, but they lack the right strategy. The right strategy to me is developing a customized treatment plan for each person that sees me for a massage treatment. This approach over the last decade has allowed me to refine my practice and improve outcomes year over year. In fact, it has worked so well for my massage therapy practice that I've turned it into part of my proprietary system, and now I make sure that every single person that works for Elite Healers Sports Massage uses the same exact process. Now let's talk about why does a treatment plan help with recovery. Well, it's the same reason consistent visits to a physical therapist help you recover, or consistent visits to the gym will help you get in better shape. When you get injured, your body's baseline fitness, it falls, and it sometimes drops to the level where you have scar tissue, limited range of motion in your joints, and muscles that are compensating. All these muscles need is a hard reset with the help of massage therapy, and this is where a treatment plan comes into play. If you're injured, one massage therapy treatment is not going to get you back to full health. One visit at best might get you to feel a little bit better, but not 100%. This is because while some muscle tissue might experience relief in that one 60 to 90 minute session, this will not fix up all the issues going on in your body. You'll have to build momentum from one massage therapy session over the next massage therapy session. And this is why I strongly recommend coming in with a frequency of once to twice a week for a certain number of weeks. This aggressive scheduling allows us to make progress on tension, scar tissue, and other issues you have from the injury without letting too much tension and dysfunction build up in between visits. The key here is in those consistent sessions being really close with one another, so your tension and compensation patterns don't have time to build back up. Now let's discuss 3 examples of when a person will come in and need a massage treatment plan. First example is the marathon runner who just experienced a leg injury. After the injury, their muscle strength and flexibility are significantly reduced and they might develop scar tissue. If they go for just one massage session, they might feel some temporary relief, but their running form might still be compromised due to lingering tightness and imbalances. However, if they adhere to a treatment plan with regular massage sessions, each session builds on the last, gradually restoring muscle function and flexibility, allowing to return to their peak running form. Second example, let's imagine an office worker with chronic back pain. Pretty common, right? This office worker, they've developed this back pain from long hours of sitting. A single massage session might provide some relief, but due to their daily posture and lifestyle, the pain and tension are likely to return quickly. A structured treatment plan of regular massage sessions can progressively address these deep-seated muscular issues and postural imbalances. Over time, consistent approach not only alleviates pain, but also helps in correcting the underlying postural issues, providing a more lasting solution. Now, the third and probably the most important example is someone who's recovering from surgery or an accident, like a car accident. Take the case of someone recovering from a car accident. They experience neck and shoulder pain. Initially, their muscles are in shock, leading to stiffness and reduced mobility. One session might ease some discomfort, but in order to fully recover, they need a series of massage sessions, each focusing on different layers of muscle tissue and scar tissue. This step-by-step approach helps in restoring full range of motion and reducing pain more effectively than a sporadic massage treatment schedule. Now, with regards to the different types of treatment plans, there's more than one set recommended time frame. This is part of the customization process I have created for my clients. So let's talk about the different time frames. First, there's the shortest treatment plan, which is about a 3 to 5 week time frame. This is what I call the minor adjustments treatment series. This is where we address discomforts and minor muscular imbalances. This plan is ideal for quick recoveries from strains and sedentary lifestyle tensions. A commitment to this concise therapy sequence can prevent the escalation of pain, ensuring a return to daily activities and getting back to being at the top of your game. The second type of treatment series is between 6 to 8 weeks in what I have called the Essential Rehabilitation Treatment Series. This particular treatment plan was crafted with moderate injuries and recurring stress-related aches in mind. This regimen is meant to help restore your strength and flexibility. This longer time commitment allows us to work through issues that need the increased focus to create lasting difference in your musculature. By diligently following through, you safeguard your physical well-being for the long term. Finally, the longest treatment series I've come up with is the 10 plus weeks treatment series. This is what I have termed the Comprehensive Recovery Treatment Series. This is an extended program, and it's a thorough approach to complex musculoskeletal challenges, which includes issues such as post-operative rehabilitation, persistent pain syndromes, and chronic pain. In cases where it's 10 weeks plus, the treatment can be towards making a recovery, but in certain other cases, it's just to help provide ongoing regular treatments to manage ongoing chronic pains. Adherence is a key to unlocking a successful recovery, ensuring you return to doing activities you love.
Now you might ask, well, Adam, how do I know if a massage treatment plan is right for me?
Well, I'm really glad you asked that question, because understanding if a massage treatment plan is right for you, it starts with understanding your personal health goals and current challenges that you are facing. Is there some injury or recurring tension-based pain haunting you which you've tried everything on your own? Well, this would be an instance where you might need the professional help of a massage therapist and the treatment plan. And the main concept here is to ask yourself, are you looking to bounce back from an injury, like our marathon runner example? Or are you seeking relief from chronic pain, like the office worker that we mentioned that was plagued by chronic back pain? Your unique situation, whether it's managing an acute condition or tackling long-standing issues, will determine the suitability of a treatment plan. Remember, if the goal is not just temporary relief, but long-term muscular improvement, then a treatment plan might be right for you. Lastly, on deciding a massage treatment plan, it requires thoughtful consideration. A key step is consulting with a professional massage therapist who can tailor a plan for your unique needs. And if you're in New York City, you're in luck, because you can schedule with us at www.elitehealerssportsmassage.com. A link is in the description. The personalized approach of a massage treatment plan is crucial for ensuring the plan is effective and not just a generic routine. If you come to see us at Elite Healers Sports Massage, we'll discuss your health history and specific goals before starting, so that way we can customize your treatments and develop a plan for you. Embrace this journey as a collaborative effort, one that demands your commitment to consistently follow through for real, lasting improvements in your well-being. Your massage therapist is going to provide you with that much-needed treatment. Now that we've talked about a treatment plan, I think it's about time that we talked about how often to get a massage. So click on that video right now and join me on the next subject, and I'll see you in the next video.